Well, it could be argued that no other medical issue gives rise to so many myths and misconceptions. Autism is a disorder of the brain characterised by social problems, language difficulties and strange, repetitive behaviours. There's no known cause as yet, but one thing is certain: rates of autism spectrum disorder have increased dramatically in Australia and indeed around the world over the past 15 years. Yet despite most of us knowing a family who may be dealing with autism, there is so much misinformation, so much confusion. Professor Tony Attwood travels the world teaching professionals and parents about autism spectrum disorders, and he admits, even after 40 years of researching the disorder, even he is still learning about it. Tony Attwood, welcome to Time to Talk.
Oh, thanks, Tim. Yep.
Now look, Tony, you're going to give us a really simple overview of autism tonight, but straight off the bat I want to dispel this idea that we need to feel sorry for children or people with autism disorders. And I know that you're very passionate about this point as well, that people with autism, they're not defective at all. They simply have a different way of seeing the world around them.
Yes, they do. What I'm looking for is understanding and compassion, to recognise that that person sees the world through different eyes, different thinking, a different way of understanding social situations, but may have talents in other areas. So it's a difference. It's a bit like being left-handed in a right-handed world.
I've experienced this firsthand, so I can say it categorically. There is confusion about it. Why does autism and all the strands of it, why do they cause so much confusion?
Well, you've asked Tim a very, very interesting question that nobody's ever asked me that before, but it's a very good one. I think with autism, one of the features is that the child or adult looks like any other typical person, but doesn't think or behave or interact like a typical person.
Sure.
So the assumption is, why is this person not being like everyone else? Because they look like everyone else. But also, we're discovering that autism goes from those who are profoundly affected by it and really are scared of people and want to stay away, to those who are desperate to have relationships and friends, have an intelligence range in the, shall we say, superior, high IQ, nutty professor types. And that sort of contradicts a sort of stereotype view of autism. And so the whole area is so broad, it's no wonder it's confusing for people.
The statistics all show that autism is increasing dramatically. I think that's fair enough to say. Do you have, after researching this for 40 years, any idea why? Is it just been diagnosed more? Why are we seeing more incidents?
There are many reasons. I mean, it's not an epidemic. It's not a huge something's happening that's causing so many more than we used to have. I was there 40 years ago, and I remember what it was like. I think what has happened is we're better at diagnosing it earlier on. There are, in fact, fewer children being diagnosed with intellectual disability and now more accurately diagnosed with autism. So previously we would say, mentally retarded, intellectually disabled, full stop. Actually, it's autism with intellectual disability. We get autism with Down syndrome. We get autism with cerebral palsy. So you can get dual diagnoses. We've widened the goalposts, including what we call high-functioning autism or Asperger's. That's the children who attend ordinary school and have a very distinct profile, but still the same components of autism. And I would say as well, there is probably a very small marginal increase. For example, autism is more likely when a couple are over the age of 35. One of the things that's happening today is people are delaying having children or starting having children until their early 30s, not their early 20s. So that's going to increase the risk of autism spectrum disorders.
I don't know if you've noticed this at all, and I'm not getting this from any reading at all. I'm put it out there that this is my personal observations, if you will. Have you yourself, after travelling around the world, noticed that there can be clusters of autistic children in particular areas?
Oh, absolutely. Part of the reason I say, is genetics. And so when we look at the parents of a child with autism or Asperger's, there's a greater than chance likelihood that the father is from engineering, accountancy, information technology, and the mother from the caring professions.
Isn't that interesting?
Teaching, social work, psychology, etc.
Wow.
Now that means if you've got, say, Queensland, a mining community with all those engineers, well, you're going to get more with autism. If you've got a farming community sometimes. Now, farming, you don't have to mix with people. You're there with the animals. You're there with the machinery. You can just get on with your work. So you're going to get a higher level in certain farming communities, or in Silicon Valley and various other areas like Houston in Texas with NASA, where there are a high level of information technology, Seattle, where there's Microsoft and Boeing. So it's not evenly distributed. One of the factors is genetics, but part of that is the career choice of parents.
Isn't that fascinating? I've never heard that before. So, therefore, the obvious next question is, what's the link? I mean, there is no discernible cause, but do you believe, in your professional opinion, that there is something in the environment causing this? Why the clusters?
Other factors can be things that affect brain development in utero. For example, there's a recent paper that looked at mothers taking antidepressants in early pregnancy could be associated with a higher risk of autism, or certain other medications can do that, or certain virus infections. It's also associated with prematurity, and more premature children are surviving with special care baby units. There's also association with virus infections or bacterial infections that affect brain development. So there are certain sort of structures within the brain that we call the autistic brain, in inverted commas, and a number of things that will affect the development of those areas could produce the autistic features.
What's your advice for people who are dealing with this, very fresh to this world of autism?
Okay, first of all, I think suspend all your expectations of what that child should be like.
Sure.
Secondly, imagine yourself as that person with the sensory sensitivity, hating people shouting or dogs barking or noises, finding faces hard to understand and body language is totally confusing, that you like routine and consistency within your life, that you have difficulty sometimes understanding nuances, certain aspects of language, and people misunderstand you too. So imagine yourself as that person, see through their eyes, then you realize how heroic that person is in coping with us social zealots.
Is it true to say that children with autism can't show empathy for other human beings?
Oh, that's a terrible insult. Terrible insult for those with Asperger's and autism. Well, I think what is happening is there that the person may not be good at reading the subtle cues of distress or embarrassment, for example. And because they don't read those cues, they don't change their behavior or respond with compassion. But they didn't see it, so they have no reason to change their behavior. But you can't assume that the person then doesn't care, because often when they see problems, you've got a broken finger or you've fallen over, they may be the first to rush to your assistance in that situation if they see the problem. But if they don't see the problem, the assumption is you don't care because you didn't respond as I expected you to.
We're coming back to that point that their perception of the world is vastly different from that of other children.
Yes.
When we're talking about treating autism or using therapies to help an autistic child, parents and carers are really in the driver's seat, aren't they? This isn't something where you ship the child off to a professional doctor. I mean, I know they all play a part, paediatricians, speech therapists, OTs, but really it's an interesting area in that the carer and the parent, they're in the driver's seat, aren't they?
Absolutely, and they're there for life. And the central hub is the child and parent, hopefully mum and dad, often mum, because dad may be working, etc. But they're the center of that hub, and they have to coordinate all the various services. So, first of all, it's difficult enough having and living with a child with autism because your whole world changes.
Sure.
But you also then have to be a project manager of organizing all this, and then acting as their advocate to explain, no, he did that because, rather than he's naughty or badly behaved.
Must be a common story you hear, Tony, that the parents and carers of autistic children constantly, with teachers and schools, daycare centres, having to explain the behaviours.
Indeed, because, again, the child looks like any other kid. I mean, if they were what we call dysmorphic, that is physical features that you could identify, or they have blue skin or two noses or something like that, then people will go, oh dear, why, they're different, aren't they? But because with autism there are often fragments of talent and ability, and people find it hard to understand, this person who can do a jigsaw puzzle in a fraction of a second, who can draw in photographic realism, doesn't know how to make friends or understand what someone is expressing in their facial expressions.
Just on that point too, it's with the autistic children that I work with, this idea that they are innately talented in certain areas, for example, mathematics or art, and I think Rain Man, the movie, has a lot to answer for here. Autistic children don't always show a grand talent for a particular area, do they?
No, 10% do. Which is larger than the ordinary population, but of course for the media, this is sensational stuff.
Sure,
you've got somebody playing the piano at a phenomenal level, or doing calculations of the day of the week that you were born on, which is good TV or good newspapers.
But it's not the common story, though.
No, it does exist, undoubtedly, but not everyone with autism has what we call a savant characteristic.
Now, can we go through some of the indicators of autism? Perhaps there's a parent listening to this right now who has noticed some odd behaviours exhibited by their young child, because this is all about early intervention. The sooner you pick up, if there is an issue with autism, early intervention, the sooner that's in place, the greater the chances of having, a happy and productive life, aren't they? So what are some of the indicators of autism?
Okay, we look at a number of dimensions. One is social relatedness. That is, are they in tune with people, motivated to engage with people, reciprocal in their interactions. Another dimension is in the area of communication, and that is the range of vocalizations, but the use of vocalizations. Rather than just chattering to yourself, that is trying to engage in a conversation with others, but also the use of body language, which can be somewhat unusual in autism, in the sense of having a little flap or a little mannerism or something like that that is eccentric and endearing to the child, but is somewhat unusual. The other dimensions are play. Often the person likes routine and consistency, may become fascinated by, say, Thomas the Tank Engine. Lots of kids like Thomas the Tank Engine, but this is Thomas to a degree that he has to take Thomas to bed with him and have everything to do with Thomas, and if you take Thomas away, he's absolutely devastated.
Obsessional?
Obsessional can be mixed up with obsessive-compulsive disorder.
Okay.
What we do know is that this child has very strong emotions, tends to hit the panic button very quickly. Panic reaction if there's change, the unexpected. Variety is not the spice of life. Mm-hmm. But another very important dimension is sensory sensitivity. That is, sudden unexpected noises of a particular pitch, vacuum cleaners, for example, or certain aromas, not liking someone because of their perfume, wanting the same food all the time because of the sensory qualities. These are very much hallmark features of autism spectrum disorder. Can also be a little bit of clumsiness, poor motor coordination skills. So we're looking at social language, play, sensory sensitivity, motor skills as a pattern. Some of the repetitive behaviors are soothing and calming.
Sure.
Sometimes they're just enjoyable. They just enjoy the mesmerizing effect of whatever it is. And sometimes they are fascinated by the sensory experience of whatever they're spinning or dealing with. But one of the crucial things is that objects may be enjoyed more than people. Now, little kids will cuddle a little teddy bear because it represents a person and personal characteristics. This kid goes to bed with a battery because batteries are smooth and enjoyable sensorily rather than they represent a person.
I suppose we've spoken about here younger children who may have autism or the indicators of autism. What about if you have an autistic child as they enter into those years of puberty? Are there particular challenges there?
Oh yes, there are. It can be that the features of autism for that individual get a bit stronger. It's a temporary phenomenon. It's just adolescence. Most teenagers go through a hard time, but if your coping mechanisms are less and the world is more bewildering for you, then there are going to be greater difficulties. But also the issues of sexuality, personal hygiene are going to be important too. But also for the more able ones, strategies not to be a target for bullying and teasing.
Because that is a huge problem, isn't it, for autistic children, that they're often socially isolated and stigmatised.
And because they're alone, they're often the target of predators. I mean, some kids can be extraordinarily kind and supportive, but also there's a counterbalance. Those that find fun in tormenting and teasing a child who's different.
Yeah. Tony, it's been a pleasure. Thank you very much for being on Time to Talk.
Okay, thanks, Tim.
Thank you very much. You're listening to Time to Talk. Give us a call tonight, 6585 2233.